Now, authorities are concerned that a man keeping wild and domestic birds and engaging with them in unconventional ways, including eating from the same plate, could trigger an outbreak of zoonotic diseases. Medical personnel say Rogers Magutha, alias the Nairobi Birdman, poses a health hazard through his close interaction with birds at his residence. But the 28-year-old man has dismissed the claim, saying he has lived among the scavengers for years. Proof, he says, that there is no risk attached. Kenya Medical Research Institute is nonetheless warning of a looming danger should the close contact continue. NTV's Hilda Kiptor now reports.
Rogers Magutha, raised in Nakuru, has made his home in Kayole, Nairobi County. Living here, Magutha shares his space with a number of companions, the birds. His relationship with these birds, both wild and domestic, has left many in disbelief. To some, it's a sight to behold. To others, it could be a getaway for zoonotic diseases. This follows clips circulating online showing him eating from the same plate as the birds. Every bird has a name, each one symbolic. Billy, Johnson, Susie, Fardosa, Jedida and Jimmy are just some of the birds we met.
Because the first bird nilipata nikiwa street, and nilipea jina Johnson the hawk. So I was living on the streets. Nikaona is as if ilikuwa abandoned, ilikuwa juu ya net, so ikaanguka chini. So hapo nikachukua tu ile nyama yenye nilikuwa nayo, since I know they are flesh eaters, and nikaamua kuipea hiyo the meat. So ikakula and then ikapatch on my hand.
Wherever he goes and whatever he does is marked by their presence, and meal times are no exception. This, however, has raised concern in some quarters, more importantly, medical professionals. Despite the backlash he's faced online, Magutha insists this has simply been his way of life.
Mi huenda kuchemba dumping site. Pale dumping site ukienda kuchemba, unapata kuna makeroma mzuri zimetoka huko kwa wasio matajiri. Unajua mtu anasema imekaa siku mbili sizidishi, acha nirushe pale, si ndio? Na hapo kwa hiyo dumping site kuna the different scavengers. If I was to get sick kama kukohoa, ningekuwa niligetigi sick kitambo.
According to Magutha, some of the criticism online stems from myth and cultural beliefs.
Mimi nimekaa na different species of birds. Ukiangalia kama siku nilikuwaga na the owl. Watu walikuwa wanasema wewe ni mchawi wala. Ati wewe ni mchawi, hautakaa siku 3.
Meanwhile, the Kenya Medical Research Institute has warned of the danger that could arise if this continues.
At the moment, we have not had cases of outbreaks emanating from birds, but there is that potential, and because that potential is there, it means that there is an existent risk of such cases where somebody is handling wild birds at a domestic level.
The institute further warned of bacterial and viral diseases spread by such birds, including avian influenza and swine influenza. Dr. Hamadi says that in the event of an outbreak, the country would likely be able to respond, but the cost of doing so could be significant.
Our healthcare system, from the experiences we had with COVID, and even currently with what is happening in the neighboring countries related to Ebola, we actually have developed our health systems. So one of the things that we do, and are working very closely with the Ministry of Health, is that we have in place surveillance systems that go around collecting samples from the field and checking for some of these pathogens.
But for Magutha, this remains his mission, to rescue the birds. Pets and their keeper, a relationship that demands possibility on the latter, else the bond will turn into a hazard with far-reaching implication. Hilda Kiptor, NTV.